Hello and welcome to Health Assured's panel discussion. I'm Maria Teresa, Clinical Development Consultant at Health Assured, and today we have a very special programme on promoting the mental health agenda in the run-up to the UK's general election. I'm delighted to be joined by a fantastic range of panellists here in Manchester, covering a wide range of perspectives from across the political, business and health and wellbeing sectors to help us answer some of the most important questions around the general election mental health agenda. On today's panel, I'm delighted to be joined by Talk TV's Chief Political Editor and former Government Specialist Advisor, Peter Cardwell, Senior Clinical Development Manager at Health Assured, Richard Kritorich, and Georgia Neve, Health and Safety Advisor at Peninsula Group. Welcome to you all. Thanks for joining me today. If you're watching us online, please join in the conversation in the question box and we'll get around to answering your questions. Okay, Peter, I would like to start with you. So this is the first general election since the pandemic, which of course we all know was a devastating time for many reasons, but has left a real mark on people's lives, and many would expect politics to respond. So can you give us an insight into what the main political parties are promising to deliver on the mental health agenda?
Well, you're absolutely right. There is so much that has changed in the last few years politically, but also in terms of how we work, the way we work, and the mental health impact of COVID, of lockdowns. And that's certainly reflected in the manifestos that the politicians have put out in what they're saying, but also what they're not saying and what they're accusing each other of in terms of whether a manifesto would work or not work. The likelihood is all the information we have says that Labour will be the next government of this country. That's not a partisan thing, that's just the information we have, what all the polls are saying. And they say that if their plans aren't implemented, well, actually there could be a real cost to what they see as the Conservative plans of £23 billion a year. And interestingly, from Labour's perspective, they want to recruit an additional 8,500 new mental health staff through their first term of government. The Conservatives, on the other hand, have talked a bit more really about the benefits system and how they want to change the assessment of capability for work, changing that from September 2025 for those with more moderate mental health issues, for example, to get back into the workforce. However, that would be whether that's through working from home or whether that's in offices themselves. The way this has been really received by a lot of different organisations has been interesting as well, because Labour, for example, has talked about accessing specialist mental health professionals in every school. They haven't talked a lot about the occupational health aspect of this. That particular policy about mental health professionals in schools is something that the Liberal Democrats have as well. Checkups, dedicated out-of-area mental health placements, young people's mental health services up to the age of 25 enhanced and so on as well. So all of these parties really are clear that there's a lot to do, but how they do it, they would do it in slightly different ways. And if you look at actually some of the implications and some of the evaluations of this, the Health Foundation, for example, says it's important to see to consider what manifestos don't say, especially about people who are economically inactive on health grounds. None of the parties explicitly recognising 3.6 in fact million people who do work, but with work limiting conditions. So it's interesting. Wes Streeting, the Shadow Health Secretary, who will almost certainly be the Health Secretary in a few weeks' time, saying in regard to tax actually that not everything that's in the manifestos is there. You know, they don't have every single plan. So we have some idea what the political parties would do after the election, but not the full picture. And of course that very much is to do with how much money there is in the system as well.
So there's quite the high demand, and it seems like you're saying, there is a lack of mentioning perhaps what the manifestos are not saying.
Absolutely, and that's other parties are criticising that and saying the costs of other people's manifestos and so on, but certainly occupational health is something that isn't focused on to a huge degree. We've also got to remember that 125 pages, 133 pages in Labour's manifesto, it seems like a long document, but that's everything. So the very sort of nitty-gritty detail of all of these policies is still to be worked out really after the election. It's also a question of what is politically possible, what the parties can do, and what kind of majority Labour has or will have, in theory anyway, to get things through.
Thank you. Georgia and Richard, would you like to speak to that at all? Just a reminder of the question. So can you give us an insight into what the main political parties are promising to deliver on the mental health agenda? Anything you'd like to add on to that?
Yeah, I mean, as Peter was just saying, for me, it's important that, as you say, there was a lot to contend with, isn't there, in terms of the potential changes, and it is multifaceted. But for me, mental health has to be at the top of the agenda, really, particularly post-pandemic and the ongoing cost of living crisis as well. So really important that that is addressed as part of the.
It's really interesting, actually, with that in mind, that previously, about 10 years ago, we heard political parties saying that mental health had to be in the same footing as physical health. We're not hearing that language just quite so much now. They do know, of course, mental health is something that we know from surveys and from information, in fact, out this week, that there are, a great increase in the number of people taking sick days, 140% increase in sick days for mental health days and so on. But it's not just talked about in quite the same way, because there is pressure on the health service. There's a pressure on how much money is in the health service, and actually how radical, for example, Labour want to be, in that both parties actually, and there's criticism from various groups saying that the proposals to raise the amount of money they put into the health service is not enough in some people's estimation, like the Nuffield Trust, for example, organisations like that.
So, Richard, over to you for a moment. So Martin Bell, the head of policy and public affairs at the BACP, said, and I quote, "There's never been a general election where the mental health of the nation has been in such a precarious state." Do you agree?
I can certainly, to a certain extent, I can understand why they've made that assessment there. As we're saying just now, around what we've seen at Health Assured in terms of the utilisation, there has been a great increase in the complexity. So there is a greater need in terms of the presenteeism that we're seeing and presentations. And then also from a risk perspective as well. Risk across the portfolio, a risk can be anywhere between 6 and 10% in terms of associated with calls, and that's risk and safeguarding as well. So, absolutely, from what we're seeing at Health Assured, and there certainly is a huge need there. But as you were saying as well, that it is looking at the funding that they have and have in place as well. So it's trying to balance it all to a certain extent, I guess.
It's quite the statement, isn't it? It's the mental health of the nation has never been in such a precarious state. Georgia, do you want to speak to that?
Highest awareness of it than it ever has been. The pandemic did not help things, of course, because the resources and the support that everyone had throughout those times was incredibly low. So a lot needs to be done around mental health issues.
It's interesting from a government perspective, I think, as well, in that so many bits of what the different political parties want to do with mental health goes across so many different sectors. It's not just a health issue, obviously. It's a work and pensions issue. It's a treasury issue. There are lots of different government departments that need to work together, and that's one thing that historically government departments just don't do. They're very, very siloed, and it is a really big issue, certainly in terms of the idea of getting people back into work. That's something that will really need a lot of cross-government, cross-departmental kind of working together and all of that, but especially because the world of work, as you guys know far better than I know, has changed so much in the last few years.
Yeah, employees need a lot more support. Employers need to provide that support for their employees, as they have a duty of care for them, and mental illness is on the rise. I believe, if you can go back to my stats, it was 49% higher than last year for mental health issues within the workplace.
Yeah, absolutely. And I think in our previous question, we just mentioned about the pandemic. I think and Richard, you come in if you feel you'd like to mention to it, but we do sometimes have a delayed response to traumatic events, don't we? So if we think, the pandemic was in 2020, we're in 2024 at the moment, sometimes we have a bit of a delayed response emotionally to the trauma that we've gone through.
Yeah, typically you do see that it is after the event, so to speak. So that's when, during the pandemic, a lot of people were just trying to get from day to day, really, and that was the focus. Whereas what you do find is that it's post the event, so to speak. That's when people then start to process and start to need that support, certainly from a trauma perspective as well. But as Peter just mentioned there, the landscape has changed as well within the workplace. We've all become accustomed to working from home, hybrid, having meetings online. having counselling online. So that's completely changed now. We find that counsellors, post-pandemic, counselling, in-person counselling was the most popular option. It was as high as 70% across the whole portfolio, whereas now it's starting to increase a little bit, but in-person is actually 25%, whereas online video is that's still the most popular option at 55%. But even though they have their benefits, I still feel as though sometimes we don't necessarily acknowledge the potential challenges that that managers and workplaces are faced when it comes to making sure that individuals are supported, particularly from a mental health perspective as well.
Yeah.
It's also perhaps a little bit about how people see work and see the value of work within their lives. We've had some statistics in the last week that say that this whole phenomenon of quiet quitting is apparently costing the economy £257 billion a year. There's also the fact that all the political parties are staking their plans on growth, on the economy growing, on people becoming more productive, and mental health, of course, is so much part of that as well in terms of how do people feel about the job and what they do in their jobs, as you all know far better than I do.
Yeah. Georgia, do you want to speak to that?
So for an employer, what they could do is appoint some mental health first aiders. I think that'd be great for them to start looking into doing as soon as possible, can start addressing these issues and getting them rectified, pointing them in the right direction for services and people that can actually help them. So these people will actually be able to realise when someone is mentally stressed, when someone is mentally unwell.
Yeah, absolutely. And I think something that we've kind of worked on a lot within Health Assured is kind of pushing how important a mental health first aider is, because sometimes it's not always easy to have that conversation with your direct line manager, with another senior member of staff. You might find it really difficult to have to explain what you're experiencing, what it feels like, what it looks like, how it impacts your life. I guess with a mental health first aider, there's a lot that's sort of unspoken, that's already understood. They've had the training, they know what it is, and you don't need to kind of go through all the details and sort of experience that horrible emotion all over again. So yeah, mental health first aid is definitely a good, at least a starting point to say the very least. Yeah.
I would add to that though that when it comes to mental health first aiders or any wellbeing champions in the workplace, you do need an EAP to underpin. They do need that support. They don't necessarily have clinical supervision that counsellors do, and so it is about making sure that any kind of wellbeing initiative that's in place, that it is well embedded in terms of the policies and procedures, so that individuals like that do have support as well in their roles.
Yeah, absolutely. Okay, so Peter, another question for you. So our global health survey data indicates that 80% of our organisations currently do not offer mental health days to their employees. Is this something that a new government should consider introducing, and would mental health days help to improve absenteeism in the workplace? So 2 questions there. Is it something that we should consider, or workplaces should consider introducing, and would it help absenteeism in the workplace, do you think?
I think it probably would help absenteeism in the workplace if people could essentially say that they just needed a day off because of their mental health. I think certainly there is going to be you're pushing perhaps at an open door with the Labour government if that is in fact what happens on the 4th of July. Now certainly there will be big changes. We know from the manifestos they have big ideas in terms of how to implement ideas on mental health, but their focus on growth and productivity is something that I think the argument can certainly be made by organisations like Health Assured and others to say, well actually this could increase productivity if you don't let, instead of someone being off for a month with some sort of major mental health episode, if they're off for a day and they can sort things out in their lives, well actually maybe that's a better investment of time. And sometimes from a small business perspective, there are lots of small businesses that really think, well, I can't afford my employee to be off for one day. But actually, when the argument is made that this is an investment, well, that's something I think both in legislation and practically could actually be something that people will start to think about in a more constructive way. It's interesting, certainly from the government's perspective, that employment law is something that they tinker with all the time. There are all sorts of changes to regulations, and there are all sorts of ways in which any new government will want to put a stamp on things. But I think that victimising people and saying that because people have to take time off for mental health, that's not something I can see really any government doing, because the context has changed, I think, in a lot of this. I think employers and employees are really thinking about this in a different way, and also given the political situation and the economic situation, employees have a lot more clout as well in terms of what they might want to do, and in terms of this, in terms of their employee rights and so on. So it'll be a really interesting one for the government to think about. Certainly, as I say, you've got lots and lots of different parts of government that would have to be involved with that. Treasury, Department of Work and Pensions, the Department of Business as well. I would imagine businesses would have a lot to say about this as well, to say nothing of health itself. So it'll be really interesting to see what happens. But anytime there's change in politics, there's always opportunity. And I think in this particular issue, it's probably an idea whose time has come.
Richard and Georgia, do you want to add anything on to that?
Yeah, I mean, I can certainly see the benefits, and any kind of mental health initiative it has to be a good thing. What I would add to that, though, is that it is like any other initiative. You want to make sure that it is well embedded, that it is in line with a wider initiative, so that individuals still have that support, so there is a good culture, a really good open culture. And what I wouldn't want to see in that respect is, potentially these days being used to mask maybe, or not necessarily mask, but as a manager, you might not necessarily then be able to identify or have that awareness of exactly what the issues are. And for me, it might help in the short term, or may well be needed in the short term. But what you want to do as well as a manager is make sure that the individual is fully supported in anything we can do in the workplace to make sure that they are healthy and fit enough to work. Then that for me is better. So again, it's looking at that the culture, but then also making sure that they have that support. So as we mentioned, wellbeing champions, EAPs and the like.
Yeah. So I get the sense it's kind of a discussion around prevention as opposed to a reaction, kind of creating that workplace culture where they feel supported and there is that preventative support in there.
But it's also very difficult when you're in a tricky economy and when you do want that growth to persuade people that actually politically this is a good idea, and it is really about that investment in people's mental health at the end of the day, every business wants to support its employees, but at the end of the day, they're generally about making money and being a successful business. But there are lots of different areas to that, and employee well-being is something that has to be factored into that, as you correctly say.
Yeah. And that comes. Oh, sorry.
So I was going to add, and when you look at generally the sickness absence and long-term sickness absence as well. Again, what we want to try and do really is prevent that as much as we can, and so it is really making sure that we have interventions in place, and so there are those touch points as well. Having those touch points and making sure that we're doing wellbeing checks, that kind of thing, can make such a difference in terms of, again, really understanding what the issues are. And yes, there may be times that you can't necessarily reduce the amount of time or bring them back any earlier, but just making sure that you have that conversation as a manager, the open communication, and again, just making sure that you do everything you can to bring them back into the workplace as well. Because research has shown if it's beyond 2 weeks absence with no touch points whatsoever, it is likely then to move into longer term absence as well, which again then comes at a huge cost, doesn't it, to employers and companies alike.
This actually isn't a political point at all. It's about a boss I used to have. I have dealt with sort of mental health issues my whole life. And I found myself saying to him on one occasion when I needed to take time off, not the full truth, basically. And he said to me when I got back to work, he said, look, I know you've got mental health issues. I'm not an expert at it, but he's a bit of an East End geezer. And he said, you're my star player. I want you on the pitch. And if you need to be on the bench, you need to be on the bench. And he was perhaps not the most in touch with his emotions as a person, but he expressed it in a really, really nice way. And he said, look, if you need to be on the bench, just tell me you need to be on the bench, and that's okay. So some of it is just trusting your employees, building that trust as an employee as well. Sorry, that's not about politics, just a personal example.
No, it's very, it's great that you can share that. And I'm sure people, in your position, it would be great to hear that it's something that you've experienced as well. Richard, you wanted to mention something?
That really is fantastic, isn't it? Because your manager at the time did actually broach it with you, and again prompted that open communication really well.
And that's what it's all about, isn't it?
Yeah, absolutely.
Okay, so Georgia, a question for you. So Rishi Sunak announced plans last month to strip GPs of their power to sign people off work as part of a wider strategy to tackle what he calls the UK Sicknote culture. So do you believe this is perhaps the right approach for the government to support people?
Unsure. I think there's pros and cons to both. So we could look at what a fit note is, and it entails a worker's medical conditions, which would then supply their employer evidence of such, and then they can start doing what is reasonably practicable for that employee, put some control measures in place, conduct a wellbeing assessment for them, stress assessment might be necessary. So the people that can issue these documents would be health professionals like GPs, you've got your physiotherapists, you have pharmacists. So it isn't just the GPs that can actually issue these sick notes. It is wider spread out. And if we look at what he actually says a sick note culture is, he actually quotes it's about young people, but is it just about young people? Is sick note culture just for young?
Richard and Peter, would you like to talk to that? Do you think it's just for the young?
Go on.
I was just going to say it's a really interesting point, and I think that young people are often demonised by politicians who sometimes see them as easy prey, really, but certainly there are all sorts of ways in which people are legitimately taking time off for mental health or physical health reasons, and there will unfortunately be some people who do play the system, and it's a really difficult dance for both employers and politically as well to get around this, because you don't want to demonise anyone, but you also, there is clearly a problem here in society, in the economy, and politically as well, that does need to be tackled.
Richard, do you want to?
Yeah, I think there clearly is I can certainly understand why they're maybe considering this approach, but I don't necessarily agree with a blanket approach to it, because ultimately there are vulnerable people that will need to actually quickly access a GP fit note as well if needed, and there can still be a stigma when it comes to asking for help. Actually getting GP appointments at the moment can be tricky at times as well, so I hear. So yeah, all of that coupled in mind, I wouldn't want to create potentially any further delays or barriers, really. So for me, I'd be looking at actually understanding the root cause, what the fundamental issues are, and then look to address those instead of, like you say, what I see as a kind of, in some ways, an easier solution, but just a blanket approach to tackle the issue.
There's only certain people that will be able to provide these, to issue these. So who else is going to replace the GPs if they take this power away from them? It's already got a backlog of lots of people that need assistance who might need to go in with mental health issues, and they can't get to the service that they need because they haven't got the resources to go to, the people to go to. We're cutting it back. We need more professionals, if anything, not less.
Yeah. I suppose that raises the question, is in then what would replace the sick note? If the GP can't provide that sick note, what's going to be the next step in terms of an employee that might need the time away from work? What happens then? And what would the repercussions be for the employee, for the organisation as well? Yeah. I guess that goes back to the question that we talked about earlier, in terms of it kind of strips that another step in the early intervention, and what does it have to get to for there to be the equivalent of the sick note? The sick note for many people is an option. It's a first step in terms of support. If that's stripped.
And actually, are you involving more medical professionals? Are you putting more pressure on already people who already have a lot to do or access to those services, as Richard and Georgia correctly point out?
Yeah.
And what I wouldn't want to see ultimately as an individual, if they're needing to take time off work for a mental health issue, let's say, and there is that added pressure and stress to be able to get a fit note. Again, for me, it's just we don't understand in the practicalities in terms of what they envision in terms of process, but yeah, to me it does sound like it could leave people in quite dire situations, really, when really just need that support.
Absolutely.
I would say that it could be a positive if people, for example, are bypassing these sick notes, kind of white lying about them to get them going to GPs and just paying for them. They might not necessarily need them. it could stop that happening, which would be beneficial, stop absence.
Okay, Peter, another one for you. So both Labour and the Liberal Democrats have proposed the idea of having dedicated mental health professionals in every primary school in their manifestos. So the Conservatives have also pledged to expand coverage of mental health support teams from 50% to 100% of schools and colleges in England by 2030. So in your opinion, do you think the plans are achievable, and how would they actually benefit young people?
Well, it's going to take a lot of money. It's going to take a lot of training. It's not going to happen quickly. You're not going to get these people in schools for the start of the new academic year, for example. But what I think everybody realises now is that being a young person and being even a child is a very, very difficult thing. Certainly there are so many different aspects to this, and actually there's a big debate. We've been having it on the station I work on as well about mobile phones for under 16s or under 14s as well, what people are exposed to. The fact that bullying, for example, doesn't just end at the school gate. Often it goes on, often sometimes long into the night. What people are putting online, what young people, even children, are seeing and putting online as well. So that's a massive, massive issue, as well as human relationships and dealing with the fact that there are so many young people who need a bit of extra support for lots of reasons that are nothing to do with being online. We also have, as we've been discussing today, much greater awareness of mental health and the signs, and as young people develop, certainly through the teenage years and so on, what that actually looks like. So I think this is a really good idea. I think it's something that a lot of parents will support. I think also it helps educate not just the children but their teachers and the parents about what mental health issues are, what they look like and how they can manifest themselves. It'll be a question of resources, it'll be a question of personnel and getting people. There is a real skill shortage in mental health, as there are in many other areas of this country, of the economy. So I think it sounds good, it sounds great. I hope it happens, I hope it is successful. And actually, if you look at the American model, for example, of school counsellors, a lot of other countries as well do this. There are lots of things to learn, and you have had, for example, Labour, I've mentioned Labour a lot today, but Labour have gone to Australia, Canada and New Zealand to look at ways in which this and other aspects of mental health in schools has worked. So there are lots of examples in Scandinavia as well, and they've often travelled and looked for those as well. So I think it'll be interesting in an education system where we don't have enough teachers, we don't have enough skilled teachers, maths teachers, for example, there aren't enough maths teachers, and people are teaching maths who aren't trained in maths, as just one example. Well, actually, where does mental health fit into all of that? I would argue that it's fundamental and that it's at least as important as any academic subject, because an education is not just about results, it's about how you feel and how you interact with the world and what you are as a person towards the end of it. Sorry, my parents are both teachers, so I got to get on my soapbox about this one. But I mean, it's a great idea. I hope it happens. I hope it happens successfully. And I do worry that it could go by the wayside a little bit because of financial constraints.
Yeah, I wonder if I can add on to that as well from a personal perspective. So I'm a former EMHP and educational mental health practitioner and worked within mental health support teams.
So I've just been mansplaining that entire thing to you.
No, it's fine, it was perfect. It was a quick little test to see how well you know it. No, so I you mentioned there in terms of the support that teachers get as well, and how potentially under-resourced they are. And I know from mental health support teams, from my former colleagues, what we used to do was a lot of support for the teachers as well in terms of psychoeducation workshops and support for them to know how to support the children with their mental health. Because if we think about it, children and young people spend so much of their day in school with their teachers, and their first point of contact, their sort of secure attachment, if we want to say, and their kind of main point of contact, their safe space, usually is their teacher, who knows them very, very well. And teachers, we know, are pulled in so many different directions and perhaps don't always have the chance to have some sort of training or support on how to help the children with their mental health from a mental health professional. So I suppose with mental health support teams, they're not just there only to support the children or to be sort of like a school counsellor. They're there to support the kind of wider network as well, the teachers, and psychoeducation workshops for the parents. And they look at the child in a really holistic manner. So we should hope, when you look at supporting the children through all the connections that they have, you would hope that it would improve their mental health at the very least, and that's where the mental health support teams do come in.
Yeah, I completely agree. It sounds fantastic in terms of, again, any initiative where there's going to be more support, more specialist support for for children on site for them. I mean, in terms of what we're seeing at Health Assured, there's a great deal more parents calling and contacting the service, looking for support for their child, and with great concerns about their child. The regular pathways, so to speak, they're a huge waiting list, and it's quite hard, really, actually, in a lot of ways. There is that almost that desperation, I guess. It's kind of, they really do need that support. Health Assured, is a standard. We're able to, like you say, support the parent to then in turn support the child in that respect, which can certainly go a long way. Although, in an ideal world, they'd have that support. Whether it is feasible or not, whether it does happen following the elections, or whether it does fall by the wayside, it does feel to me, though, as well, as maybe a drop in the ocean, really. Again, we're seeing a lot of complexity within schools, primary, college and universities. But so, yeah, for me, it's almost, when you look at that, the specialist training that individuals are going to actually need on site to effectively support children as well. It's going to take some huge injection of money.
If it's attacked first, though, at younger age, then it would create a brighter future for the economy later on, because it should have been helped prior to the future when they're going to work. They'd had the support in primary schools and the colleges. So I do think it definitely should be implemented, and sooner than 2032.
I think, Richard, you mentioned something there. We do often get calls from parents who are concerned about their children and the young people in their life, and that does impact, I suppose, their absence from work as well, when they have to stay home and look after their children. If their child's not well enough to go back into school, who's going to look after them? Mum and dad, or whoever the guardian is, has to stay home, look after them, and then it impacts the organisations. It's a real knock-on effect.
Yeah, it does. Yeah, absolutely, and that's why we always look at it as the household as well. In terms of how it's maybe affecting the partner, or like you say, the wider family as well. And but it is, again, that early intervention, and I think young people generally, have been hardest hit in a lot of ways following the pandemic. Again, lots of changes in terms of certainly younger children, in terms of their development as well, and how it's impacted their development in terms of communication, social skills and the like. And so, we still don't know, really, do we, in terms of what kind of legacy there is in terms of what happened with the pandemic and how it has impacted children that age. But yeah, any initiative sounds fantastic. If there is going to be further mental health support for children and for teachers as well, because teachers, they have enough to deal with, don't they? You want teachers to be able to just focus on teaching the children and not, then they've got that additional support for mental health issues and that kind of thing.
So Richard, one for you. So in recent years, millions of people have been struggling with increased financial pressures and a cost of living crisis, which has massively affected mental health, as we're aware. A survey from the Mental Health Foundation found that 29% of adults are experiencing stress, which I'm sure we've seen in our helpline. 34% are experiencing anxiety, and 10% feeling hopeless because of their financial worries. So what can people do you think, to manage their worries during this time? And what actions can the government take to reduce the financial burden? So two-part question there. What can people do to manage their worries, and what can the government do to reduce the financial burden, do you think?
Okay, yeah, I mean, in terms of the financial side of things, I would say that it is important, first and foremost, that you do address it. There can be a tendency when it comes to debt or any kind of money worries. There can still be a stigma around sharing that and looking to deal with that. So it isn't individually saying, it's not a case of putting your head in the sand. And so first and foremost, it really is looking at ways that you can address it and talk about it as well. Interestingly, from a helpline perspective at Health Assured, we are finding that that there is an increase in legal calls and advice calls or financial related calls as well. And what we do find is that with any kind of stressor or anything like that, if we are able to address any kind of stressor in the short term, then ultimately that will stop it from manifesting further and affecting someone's mental health as well. So again, my key advice really would be to, first and foremost, don't, the kind of that tendency just to kind of try and push on by yourself or forget, try to kind of put your head in the sand. But first and foremost, it is essentially, asking for help, reaching out. There is a great deal of support when it comes to financial advice and budgets and the like, and we do partner with Money as well, which is a financial advice and support option as well. So, but yeah, it is, again, I think individually, in terms of what I see, people can unfortunately leave it until it's really at that breaking point, and that's what we want to avoid, really.
It is quite, I think perhaps it's not massively talked about, the impact that financial strain can have on mental health. It's such a difficult thing to experience. And I know we've mentioned the pandemic a lot, but it's such a massive historical event that's impacted millions. But people, for example, who were, are coming out of the pandemic looking into perhaps buying a house or making these big financial steps in their life, and they're massively kind of blocked or are unable to do that. And I guess it impacts their kind of self-satisfaction, where they imagine themselves to be at a particular age. They thought potentially, when I hit this age, I would have bought a house, I would have done this, I would have done that. And it gets to the stage where perhaps an existential crisis, this is not where I thought I would be. And it stems from this kind of shackling financially, that they're just not where they thought they could be, and it really does impact their well-being. So if we're thinking then in terms of potential ideas, what actions do you think the government could take potentially to reduce this financial burden? Quite the question.
Yeah, that's quite a question.
I think they need to start. I used to be on the advisory board of the Money and Mental Health Policy Institute, which Martin Lewis set up, which is a really, really good organisation which looks into this and looks into the mental health impact from a policy perspective. If the government listened to them and to what the mental health sector is saying about this, that would be a really, really good start, because the pandemic was a weird thing that kind of put people's lives on hold, but then once we got out of the other side of it, some things were exactly the same, some things were very, very different. And those milestones in life and just development, it felt big enough. What I experienced in my mid-30s, imagine if you're leaving university or a child, or just someone who had one of those sort of life kind of staging posts within that. So that can be a much, much greater thing. There's also with young people, 2 years is a much bigger part of your life than if you're, a 40-year-old like me. So it's an important thing there as well. But really, the Conservatives would certainly say that they've got inflation down now to 2.3%, and that was a major part of what they want to do with the economy. Labour will say they want to go for growth, but none of these things, inflation's still rising. Growth will take time, even if it does happen. This isn't going to be solved overnight. We have the highest burden of taxation as a percentage of what the country earns since the Second World War. So high taxes and a cost of living squeeze are something we're going to have to deal with for a while. So the kind of resilience aspect of it is something that, both on a personal level but also on a societal level, we're going to have to start thinking about a bit more. The standard of living that my generation has, for example, in retirement will be very different from what my parents are enjoying in retirement now, and those kind of expectations will have to change. So really there is a major mental impact currently, but also in future, in terms of what the sort of financial impact outlook looks for, even for people in good jobs, never mind people who are really struggling or even struggling to find employment.
Yeah, I was just going to add as well, and interestingly, we have seen a huge increase in relationship support calls on outline as well. And so again, that is fundamentally the financial pressures that households are under, and unfortunately, it is actually taking its toll in terms of relationships as well. So it is a huge worry, and it's a difficult question because it is so multifaceted, and again, there isn't any easy answer really, is there, in that respect. But again, for me, it's just from an individual perspective, it's people when they need help reaching out for it, really, because it is that, but certainly it's that.
So just from an employer's side, making sure that you have the resources available for the employees, for example, like your EAP, like your assessments, maybe a mental health first aider again.
I think, Richard, I don't know if you want to speak to this a little bit, but sometimes with an EAP, it's often sort of stereotyped just to be like a counselling service or a helpline, and often many employers and employees alike don't understand that it is much more than that. And there is, like Health Assured offers legal advice, financial advice, structured counselling sessions, and so on. So I don't know if you want to speak to that maybe a little bit.
Yeah, I mean, it's changed a great deal, hasn't it? So back in the day, EAPs were very much a short-term service, predominantly telephone as well, whereas, as you say now, there's a greater need, and with that a greater expectation as well in terms of what we provide. And so, that may be longer session models, longer than 6 and 8 sessions. It is the legal support that we provide as well, which has become so important, so vital in the current times that we have, as we talked about just now. And then all the specialist support as well that we're finding that we are providing as well. And then again, that's indicative though of just the greater picture, really, the bigger picture, and again that greater need when it comes to more complex issues and higher risk.
Okay, a question for you, Richard. Is the NHS well equipped to deal with the growing mental health crisis? Quite the question. And what can the next government do to help the NHS be more proactive to reduce the number of people on community mental health care waiting lists? So long waiting lists, and do you feel perhaps it's well equipped to deal with the mental health crisis?
Well, I guess it isn't currently. There certainly needs to be improvements there, and again, looking at the huge waiting list that people, are experiencing at the moment. But for me, I think it is about a community level. It is about that prevention, really. So prevention really is key, and again, early intervention. So at community level, what we want to do is to have that, build that community resilience. So whether that's looking at on an individual basis, on a place-based basis, it could be raising awareness, reducing stigma, and again at a community level, though, really understanding that community. So again, a place-based. So there is a bit more of a strategy in terms of what the needs are as well. So again, looking at really at more a strategic level. But yeah. I think that for me is key, and that could be a better way of utilising any kind of funding or resources as well to address those waiting lists.
It's quite the question, isn't it, Peter and Georgia, in terms of is the NHS well equipped to deal with this level of mental health crisis?
I remember a very senior person in the NHS saying to me a couple of years ago that the NHS is like a small country in terms of the number of people who work for it, in terms of its budget, in terms of what it does, and also in terms of the pressures that are on it. And since 2010, when the Conservatives came in with the Liberal Democrats, the NHS in England had somewhere in the region of £139 billion a year spent on it. Now it's £180 billion. So there are many public services that would have loved to have seen such a rise in the amount of money spent. Now that's still low by some European averages per capita. But interestingly, from that perspective, it's clearly not just about money, it's clearly about reform as well, and how the NHS does things. And like a supertanker, it's very difficult to change direction on something as big as mental health. So it'll be really interesting if, let's say for the sake of argument, a Labour government tries to change the supertanker on mental health. They certainly have a number of policies. Wes Streeting, the Shadow Health Secretary, has written a lot on this. I was reading an article by him recently in the Daily Telegraph. They have very bold plans, governmentally anyway. Whether that filters down to how mental health is dealt with in the community, for example, in schools, as we were talking about earlier, well, that's going to take time, resources, reform, and personnel as well. So it's a big task.
I think, like you mentioned, we've got things like the mental health support teams, which come in as an early intervention.
Yes.
Perhaps supporting the NHS, preventing those waiting lists from becoming so long. But like we mentioned in the previous question, it needs a lot of support in terms of getting those mental health support teams rolled out into schools and helping the children at perhaps the primary school level and then the high school level and preventing, which will take us on to another question in terms of the older student mental health support as well. Richard, did you want to add?
Yeah, just again, really, it is having, I mean, there's not going to be an overnight fix, but it is having a more of a joined up approach as well when it comes to community level. So you want to make sure that, these services are promoted, that we provide for education as well. So ultimately what we want to do is to be in a position where individuals are actually able to manage their own mental health to a degree as well, and not be so reliant on community services in that respect. So again, that's another way of addressing the waiting list there as well. There isn't going to be a quick fix, unfortunately. But again, prevention is absolutely key and early intervention. But that place-based support is really important, because the funding, like you said, the funding has been huge. There is a never-ending pot in that respect. But is there a way that we can use that funding more effectively as well? So place-based, I'd say is the way forward in that respect.
You mentioned there in terms of self-help and like knowing and recognizing ways in terms of helping yourselves. So kind of coping strategies, coping mechanisms, and I think that comes in terms of support in mental health professionals teaching children, young people, adults, whoever it may be, in terms of psychoeducation and helping them to help themselves. There's a word I'm thinking of, it just slipped my mind. Taking kind of autonomy and feeling kind of in control of yourself, and perhaps Empowering, there we go. Yeah, that's the word, empowering others to kind of take control of their own mental health. And Peter, do you have anything potentially you'd like to add in terms of the student mental health crisis, and perhaps any policies that might come in helpful specifically for students and the challenges they're experiencing?
Tertiary education has changed a lot in recent years, and certainly it's more consumer focused. These people are paying usually very high fees, they're getting into debt already, they're entering the workplace with a lot of debt, and there's so many pressures at that time of life as well. So I think that universities are under pressure, they're making a lot of redundancies, some of them are closing. It's becoming a more of a market economy, and the government, I think, is recognising that. There will be reform, I think, to third level education, but certainly for the students who are experiencing that from a mental health perspective, it can be a very, very difficult time anyway, but certainly with an economy that the government wants to create more jobs in, wants people to have more focused degrees, it wants people to get jobs that are related to those degrees. Overall, the direction of travel, I think, is a positive one, but there are clearly many, many problems in that sector, and undoubtedly that has a mental health impact on the young people going through it, and indeed their lecturers and other staff.
Absolutely. I think that goes back to something that Richard raised as well. We said, we do have even some students calling up in terms of financial concerns, and we're going back to the tertiary education, if you mentioned that in particular. I know from myself, a concern I have personally is, for example, from the very first instalment of student loan I got before I'd even graduated, and I speak for myself and other students from my cohorts, we're already incurring interest on those student loans that we've taken out. Very high interest comparatively to those, in a slightly older generation, perhaps. And again, I think that kind of links to the student mental health. It's not just stress in terms of, oh gosh, I've got university deadlines, or, I'm going through a relationship crisis. That financial concerns really start at that very, arguably quite a young age of 18. You've just started university.
And you're perhaps not used to being, sorry to interrupt, you're probably not used to being in debt, for example, for a lot of 18-year-olds, 19-year-olds, and suddenly you're thinking, what if I don't enjoy my course? What if it's not going to get me a job? What if I have 50, 60,000 pounds worth of debt at the end of this, and it hasn't been worth it? And actually, it's interesting from the world of work perspective as well. We'll be talking a lot about that today, in terms of apprenticeships, for example, where, my friend's daughter, I'm not at that age where it's people's kids, is doing an apprenticeship where she works 4 days a week and goes to university, or does a university course 1 day a week and one night. She's not paying any fees, her employer's paying that as well. So I think it's interesting to when people are coming at it from a sort of commercial commodity perspective rather than education for the love of it.
Something that's I hear a lot is necessarily that education and a university degree is a tool, it's sort of like a key to a lock to kind of get you in. But I think you mentioned something there in terms of a lot of people questioning, what if I don't even like my course? Or what if I've spent all of this money, I'm in this massive amount of debt, I've incurred all this interest, since the very first instalment. What if it's just all a waste?
It's a lot more serious these days. I think there's a lot more at stake with the university education, because previously if you just, drank and danced and enjoyed yourself for 3 years and came out with a reasonable degree at the end of it, that might be all right. But the world of work is different, the economy is different, the financial element is different. There's a lot of pressure on young people.
Richard, how do you feel about potentially what Peter mentioned in terms of that sort of apprenticeship and working, studying, and the employer perhaps supporting them financially?
Yeah, it certainly, there is more at stake, isn't there, when it comes to, it isn't simply a passage now, it is a real kind of huge decision in terms of, like you say, the fees, so the university fees, accommodation fees have increased as well, and then living costs as well. So there's all these additional costs that students are faced with. So I'm sure that students don't take that lightly, and there still are, there's still lots of professions where you would still go to university and beyond. And so, but interestingly though as well, we are finding that again, that it is that financial pressure really that students are really kind of concerned about. The Student Happiness Index for Ensley this year, they actually found that in a survey with students, 43% of students were concerned about their finances, and that was the top reason as well. And when you actually put that into perspective, like you've said, there are other worries that students are faced with in terms of the actual the teaching, the learning. Will I pass? Meeting new people, potentially living in a new place. What job am I making the right decision when it comes to career and the job and the like? So there are all these, I guess, standard, expected worries. But now students are faced with that real worry around, can I actually afford this, and can I afford to live really? And so but yeah, absolutely right. There's a great deal more at stake. I mean, in terms of policies or I guess any kind of initiative or policy that the government can make to aid students when it comes to the said fees and that kind of thing, then that would, I'm sure, will make a difference.
For a lot of young people, that might be the first time that they're financially, quote unquote, independent or responsible over their finances, or leaving home and having to figure out, how much does an average grocery shop cost, and what's my, average income, how can I afford that? How do you feel potentially, Peter, about, government initiatives around potentially educating young people on how to manage their finances, kind of financial knowledge and kind of...
Well, that absolutely must be at the heart of things in school a lot more. I don't remember very much about algebra, but I do remember the day when my home economics teacher told me how to cost out how much a meal would be for a family, for example. And I mean, Georgia probably knows more about this than I do, but certainly that transition as well from essentially being your own boss for 3 or 4 years and then into your first job, which is the one that's apparently going to solve all your problems financially, it's your first job. There must be so much hope that young people have when they move into that first job, and I'm sure there's a mental health impact in that as well.
Oh, absolutely, I agree.
Especially when maybe it doesn't turn out to be exactly what they want it to be.
Yeah, that's why your duty of care as an employer is so important, just to make sure that you are keylining these things and staying on top of them, making sure that you're aware of these things that are going on, and people coming from very young ages into the first line of work can be very scary, and lots of different reasons why they could become mentally ill or
do they expect too much sometimes, do you think, from their first job?
Depends. I think sometimes they do, sometimes they don't. It would depend on what line of work they're going in for, and what they've been told that they can get, what other people get in their line of work, I think would also affect that. Yeah,
and seeing, I'm sure, a lot of their peers and things, some of them maybe doing better, earning more money, some of them struggling, that sort of thing. That's bound to have
senior levels, their stage, maybe they're not as competent as they'd like to be. It's and then that would come into development. Your employer could then start helping you develop yourself to become more competent, etc.
So if we just have a little chat for a moment about childcare. So on childcare, let's have a little think. So the Conservatives have said that they would extend 30 hours of free childcare a week available to eligible working parents of 3 and 4-year-olds to include 2-year-olds by 2025. So they claim that this would save families around £6,900 per year. So Peter, I'm just going to direct this to you. So do you think the policy goes far enough to address the challenges facing working parents and carers, especially those on lower incomes, perhaps?
Well, look, childcare is a huge outgoing for so many people, and especially people who want to get back to work, perhaps want to work full-time or even part-time. It is a massive financial consideration, especially when, I mean, it was really always the case, but now, of course, there are people thinking, will I have a second child, for example? Can I afford to do that? Can I afford to have a third child? When previously, families were often a lot bigger. So the whole nature of work, the whole nature of the family structure, of course, has changed as well. Often people don't live near relatives who could perhaps provide that kind of support. So from a governmental perspective, and actually a number of workplace experts are saying, you know, if you can get people back into the workplace after having children, that can really help productivity, help growth and so on. But of course creates jobs as well for people who are looking after those children. But of course there's so much regulation around how many people need to be, you know, the ratio, for example, of children to carers. There's a lot in this, and I think that the inducement certainly to say that you can get free or reduced cost childcare will certainly make people think differently about what they can do, because they've got to plan it out again financially in terms of what they can do. The big issue in this election as well is the 2-child limit in terms of benefits, and that's something which all parties are coming under a lot of pressure with, because it is pretty difficult, and the cut-off was 2017 for that. So that's something that I think certainly the left of the Labour Party would have wanted the sort of Starmer to go further on, for example, but that hasn't been the case. So really, with a lot of the childcare issues, it's absolutely massive when it comes to workplace, when it comes to how we deal with things as a society, and also mental health as well, in terms of how much you see your kids, how much time you have for them, and what kind of relationship you have with your workplace as a result. I remember seeing that a survey of men who had taken paternity leave, and when you know, it's not just the law, it's how the law is implemented and how many people take up these things as well. With paternity leave, it was something like 3% of men took up the full gamut of paternity leave that they could take, and they surveyed men and said, why would you not take up the full amount? And I said, well, maybe my boss might think I have other priorities, maybe they might think that my children were more important, maybe they see me first as a carer and second as an employee. And I just looked at that and thought, well, so many women have dealt with those issues for such a long time in the workplace. Maybe that's actually a good thing that we're having that conversation and saying that people often do, for example, have other responsibilities that are equally, if not more important.
Yeah. I think just to speak on the paternity leave, if I can for a second, I know from a particular scenario I came across before, we had a particular young man who was signed off sick from work by his GP, and he had to hand in a sick note to his workplace saying that he's not fit for work. But upon having a conversation with him, it turned out that he himself is absolutely perfectly fine, but it's his partner who is struggling with her mental health after having quite a traumatic birth, he mentioned, and she was struggling with postpartum depression, and he had serious concerns around her health and the baby's health as a result. He was scared for her safety and the baby's safety, and he had requested, you know, perhaps some flexible working from his workplace to potentially work from home where possible, to, you know, put the baby to sleep for a moment while his partner has a nap or looks after her own mental health, and that wasn't accommodated, and as a result he had to take sick leave off work. Georgia, I wonder from like a health and safety perspective in terms of his well-being as an employee, as a father as well.
There are well-being assessments to be carried out in this instance. For anyone with a medical condition or an injury coming into work, you would conduct a well-being assessment, which is essentially looking at control measures to put in place what's reasonably practicable to help them do their job safely and effectively. And again, so working from home might be a very good option. There are lots of different things that you could put in place for different employees. Just depends on their issue and what you can do for them. But there's so many different options. Really important to carry out.
Yeah, absolutely. And I think it goes back to that culture that we were talking about in terms of that open and positive workplace culture. You know, if you want to speak to a member of staff about how you're doing mentally, but also how your family is doing mentally. And again, linking back to student mental health, to children's mental health, how that it all links. You know, we're so much more than just our job. We're individuals, we're mothers, we're fathers, we're children, we're aunties and uncles, and we have a wider life that impacts our ability to work. And I suppose the workplace also has a responsibility to an extent to duty of care.
So they must do everything that's reasonably practical to help that employee. Whether it's non-work related or work related, if they notice there is an issue, they have a duty of care to that employee.
Absolutely. Do you want to speak to that, Tom?
Yeah, I mean, for me, absolutely, we need to be supporting parents in the workplace in any which way we can. I did see some research actually whereby I believe it was 1 in 10 mothers actually had to quit their job because they simply could not afford to work. And so, that's a situation where individuals, they do actually want to be in the workplace, and unfortunately they're not able to. So absolutely, anything we can do to assist or help in that respect has got to be a good thing.
And I wonder if that links as well to the children's mental health. Peter, you mentioned earlier that sometimes parents aren't always able to be there for their children during those critical periods of growing up because they can't afford to be off work. They have to go to work. Perhaps reluctantly, they don't necessarily want to leave their children, but they have to leave their children, in daycare or in nursery or with a babysitter because they've got bills to pay. And that's, again, the financial burden, how it's, I think for those who perhaps are watching and listening can see how it all is just a sort of a vicious circle. It all links, and it's just knock-on effects from financial to the workplace, to the children, to the families, to the schools, to the teachers, to the NHS, to...
But at the same time, I agree with all of that, but I also think that, there is a real... Rishi Sunak often talks about the dignity of work and saying that actually you can provide an example. Both my parents worked full-time, for example, which was rare in that part of Northern Ireland for that time. And I knew how much my parents, especially my mother, loved their jobs and how that was an incredibly important thing to them, that it wasn't just about being a mother or father, it was about doing what they did and how that was such an important part of them. And that really inspired me and so let me see them and see work actually in a different way as well. So there are all sorts of aspects to this psychologically in terms of mental health and so on, and also saying that actually there is something really good about getting up in the morning and going to work and being useful if you can, if you're available and ready and willing and have the ability to do it. That is something that is so incredibly important for your mental health. Actually, it really can help you to say, yeah, I'm being a useful, productive member of society as often as I can.
Absolutely. And I think that goes back to kind of having the freedom to choose.
Yeah.
If you feel ready to do so rather than feeling forced to do so. I suppose everything in moderation. I think it goes back to that.
I just wanted to add though as well, again, times have changed, haven't they? So we don't necessarily, parents don't necessarily have that support that they would have had. And so, people do move away from their families and may be alone, so don't have that support network as well for childcare. So yeah, it is one that we do.
Absolutely. So a final question now, bringing it to a close. So how do we see perhaps the general election playing out? Will the Conservatives hold on to power, do we think, or will it look like a Labour landslide, as Peter, you mentioned? It's looking like that potentially with the polls. Or potentially could we be looking at a coalition government? So how do we see the general election panning out, do you think?
So it depends if you believe the polls. It depends. I mean, every bit of information we have, the local election results, by-elections, all the polls. The Conservatives have not been ahead in a poll for 3 years, since November 2021, nearly 3 years. So it's looking like a Labour victory. The size of the majority is a big issue, certainly. We'll see whether it is the huge super majority that the MRP poll from Survation at the weekend showed, which would put the Conservatives down to 72 MPs, which would be really, really dramatic, and I think would have big implications for, you've got to have a certain number of people to be shadow ministers and to be select committee chairmen and women and so on. So that would make a big difference. But I think this election is perhaps not about who wins, but what the opposition looks like. The Conservatives are in a really, really bad state. They're in a sort of death spiral. Reform UK, what happens there? Could they have up to 9 MPs? One poll suggested at the weekend. What about the Liberal Democrats? Are they just a protest party, or do they come back? Can they have different luck to what they had in sort of 2015 onwards? Talking about students and tuition fees, that's never forgotten. So there are lots and lots of different aspects to this. The Green Party as well did really, really well in the local elections recently. Could they pull through and have maybe 3 or 4 MPs? They're quite threatening in Bristol, for example, to a member of the shadow cabinet. This is going to be really, really interesting to see, not just what happens, but also what happens next, what happens over the next 5 years, because the UK will be a different country in a few years' time, no matter who wins the election. But as I say, all the information says Labour, Keir Starmer as Prime Minister, but what he's able to do and the promise, and there's always hope for a lot of people, for Labour supporters certainly, that this will be, maybe 10 years, a decade of renewal, Keir Starmer talks about. But of course, the one thing I have learned covering politics for 15 years is that nothing is predictable. I mean, if you said to me 10 years ago, Donald Trump will be President of the United States, there will be Brexit will happen in the UK, and Boris Johnson, yeah, he's going to be Prime Minister, I would probably have said no to all of those.
So it's still, I guess, massively unknown. Georgia and Richard, anything you'd like to add to that, perhaps?
I mean, for me, regardless of how it goes and who is in power, they have to put mental health at the top of the agenda. So that that ultimately is so important, and that's what we're here for today. So yeah, for me, that's the big focus.
I agree, and then hopefully they will carry out everything that they've suggested to put forward.
All I would just add as a final note is, if you don't vote, you don't get to complain. So please go and vote.
Yeah, please vote.
Is that your final takeaway message?
It is, yes.
Great. Thank you very much for those statements, and thank you for that, Peter. I think it's fair to say that it's been a really fascinating conversation today, and I want to thank my panelists, Peter, Georgia and Richard. Thank you very much for joining us today, and to everyone who has been watching remotely and engaging in the conversation as well. For now, though, thank you very much to you all, and thank you, of course, to Health Assured for allowing us to host the panel discussion today. If you would like to find out a little bit more about mental health and wellbeing and how Health Assured can help with your organisation, please visit www.healthassured.co.uk. Thank you very much.